If you are on Medicare Advantage, and right now more than 33 million Americans are, your insurer denied 4.1 million requests for care in 2024. That is not a rumor. That is a number from the Centers for Medicare and Medicaid Services. And what the insurance companies are not telling you is that more than 80% of the people who pushed back on those denials won. The care was approved. But almost nobody pushed back. Most people just accepted the denial and went without the care their doctor ordered. By the end of this video, you will know exactly what to do the moment you receive a denial letter, and it starts with a single phone call that takes under 10 minutes. The rules around Medicare Advantage prior authorization change every single year. CMS does not send you a personal letter when the rules shift. What I do on this channel is track exactly what changes, when it changes, and what it means for your wallet and your health care. The people who are subscribed find out in time to act on it. The people who aren't tend to find out after they've already paid out of pocket for care their plan should have covered, or they never find out at all. Hit subscribe, turn on the bell, and let's get into it. Here is what is happening right now in 2026. Medicare Advantage plans, the private insurance plans that replace traditional Medicare for about half of all Medicare recipients, are required to get your insurer's permission before covering a wide range of services. That process is called prior authorization. Sounds reasonable. The problem is that a federal watchdog just confirmed that the three largest Medicare Advantage organizations in the country, United Healthcare, Humana, and CVS Health, denied prior authorization requests for post-acute care at some of the highest rates in the country. In some cases, more than 70% of requests were rejected. That includes care after a stroke, after a hip fracture, after a heart attack. Care that costs on average $24,000 to $49,000 per stay that your doctor says you need, rejected before you even leave the hospital. This is not about people gaming the system. This is about a system that is denying first and relying on the fact that most people will not fight back. The data proves it. Only about 12% of people who got denied in 2024 filed an appeal. And of those who did, more than 80% won. Let that land. More than 80% of appeals were overturned. The care was approved. The denial was reversed. But 88 out of every 100 people who got denied just accepted it and moved on. Some paid out of pocket. Some delayed their care. Some went without it entirely. Today I'm going to walk you through 5 things you need to know and do right now to protect yourself and the people you love. Stay for number 5. It is the one that most people never discover. A legally protected option that can force your insurer to respond within 72 hours, not 30 days, and it applies in more situations than you might think. Number 1. Your denial letter is a legal document and it has a deadline attached to it. When a Medicare Advantage plan denies prior authorization, they are required by federal law to send you a written notice. That letter must explain the reason for the denial and tell you exactly how to appeal. Here is the part almost nobody reads carefully. As of January 1st, 2025, you now have 65 days from the date printed on that denial letter to file your appeal. Not 60 days, 65. That window was extended. But the date that matters is the date on the letter itself, not the date you received it. Picture this. You come home from a procedure consultation. There is a letter on your kitchen table from your Medicare Advantage plan. You set it aside. You figure you'll deal with it over the weekend. Then 2 weeks go by. Then a month. You've already started paying the bill because you assumed the denial was final. It wasn't. You had 65 days from the date on that letter to fight it for free. The clock is running the moment that letter is printed. The action step here is simple. The moment you receive any denial letter, write the date on the front of the envelope in pen. Count out 65 days on a calendar and put a reminder in your phone. Then call the member services number on the back of your insurance card and tell them you intend to appeal. You do not need a lawyer. You do not need a professional. You need to say the words, "I want to file an appeal." Number 2, your doctor's letter is worth more than you think. Here is what most people don't know. When you file an appeal, the single most important thing you can add to your case is a letter of medical necessity from your treating physician. Not a note, a letter. It should say specifically why the service is medically necessary for you, why alternatives are not appropriate, and what the clinical consequences of denial would be. Insurance plans are required to follow Medicare's official coverage rules. If your doctor can document that your case meets those rules, the plan has an extremely limited basis to uphold the denial. Here is the human moment. Your cardiologist recommends a cardiac rehabilitation program after your heart procedure. The plan denies it. You call the insurance company. They tell you the program is not medically necessary. Your doctor disagrees. What most people don't know is that a one-page letter from your cardiologist, citing your diagnosis, your procedure date, and the American Heart Association guidelines for post-procedure rehabilitation, can flip that denial into an approval. The insurance company's reviewer will see that letter, and the legal risk of continuing to deny a medically documented, guideline-supported treatment is significant. Ask your doctor or specialist to write you a letter of medical necessity before you file the appeal. Many doctors' offices do this regularly and will not charge you for it. When you file your appeal, submit that letter with it. It is the single most effective tool in an appeal. Number 3. There are 2 types of appeals, and most people only know about the slower one. A standard appeal for a Medicare Advantage prior authorization decision gives your insurer 30 days to respond. That is the one most people know about or stumble into accidentally. But there is a second type of appeal that almost nobody uses, and it is legally binding. It is called an expedited or fast-track appeal. If your doctor believes that waiting 30 days for a standard decision could seriously harm your health, and your doctor must agree and confirm this, you can request an expedited appeal. Under federal rules, your insurer is required to respond within 72 hours, not 30 days, 72 hours. Picture this. You are in the hospital recovering from a stroke. Your neurologist recommends transfer to an inpatient rehabilitation facility. The Medicare Advantage plan denies the request. Under a standard appeal, the plan has 30 days to review. You will be discharged from the hospital before that decision ever comes back. But if your neurologist documents that delaying the rehabilitation placement poses a serious risk to your recovery, you trigger the fast-track process. The plan must respond in 72 hours. In a situation where every day of delayed rehabilitation affects long-term outcomes, 72 hours versus 30 days is the difference between getting care and losing the window for recovery. To request an expedited appeal, call the member services number on your insurance card and use the specific words, "I am requesting an expedited appeal because my doctor believes a delay could seriously harm my health." Then ask your doctor to contact the plan directly to confirm the urgency. You can also call 1-800-MEDICARE, which is 1-800-633-4227, available 24 hours a day, 7 days a week, if you need help understanding your rights in the process. Put that number in your phone right now. Number 4. If your plan denies you twice, the review moves outside the insurance company entirely. Here is what the system does not explain. The appeals process has 5 levels. Most people never get past the first denial and give up. But the structure is designed so that if your own insurance company upholds the denial at level 1, your appeal moves to level 2, which is reviewed by an entirely independent organization, not affiliated with your insurance company in any way. It is called an independent review entity, contracted by CMS specifically to provide neutral review. What most people don't know is that the independent entity overturns a significant share of the denials that the insurance company upheld. When you remove the financial incentive of the insurer from the review process, the outcome often changes. And if Level 2 does not resolve it, there is a Level 3 review by the Office of Medicare Hearings and Appeals, a federal body. Then Level 4. Then Level 5, which can reach federal court. Here is the practical moment. You filed your Level 1 appeal. Your plan reviewed it and denied it again. Most people stop here because they assume the second no means it's over. It doesn't. The second denial triggers your right to an automatic Level 2 review by the independent entity. You have 60 days from the date of the Level 1 denial notice to request Level 2. You contact your plan, tell them you are escalating to Level 2, and request that your file be submitted to the independent review entity. CMS requires this transfer to happen within a specific time frame once you request it. The second no is not the final answer. It is the trigger that gets the insurance company out of the room. Stay for number 5. Because it is the step that takes 10 minutes and applies to a situation most seniors never expect to be in, being denied care while you are still inside the hospital or a nursing facility. It is the fastest legal protection Medicare has built, and almost no one knows it exists. Number 5. If you are receiving care right now and your plan says it is ending, you can get a free review within 2 business days, and your care continues while they decide. This is the most urgent situation in the Medicare Advantage denial system. It happens when you are already receiving care, you are in a hospital, a skilled nursing facility, or receiving home health services, and your Medicare Advantage plan notifies you that it intends to stop covering that care. They might say you no longer meet the criteria. They might say the stay is no longer medically necessary. The notice comes while you are still in the bed. What almost nobody tells you is that you have the right to an immediate Quality Improvement Organization review. CMS contracts with independent organizations called Beneficiary and Family-Centered Care Quality Improvement Organizations, specifically to handle these real-time disputes. You call them directly, not your insurance company, while you are still in the facility. Here is the scenario. You are in a skilled nursing facility recovering from hip replacement surgery. On day 12, the plan sends you a written notice saying your stay is no longer covered after 2 days from now. The bill for the facility is $500 per day out of pocket. You are not ready to go home. Your physical therapist agrees you are not ready. You have the right to call the Quality Improvement Organization for your region. They will contact the facility, review your case, and deliver a decision within 2 business days. And here is the part almost nobody knows. If you call before the coverage ends, your care must continue at the plan's expense while the review is underway. They cannot discharge you and then review later. The protection runs forward, not backward. The number to call depends on your state. CMS assigns a Quality Improvement Organization to every Medicare beneficiary. You can find yours by calling 1-800-MEDICARE. That is 1-800-633-4227, and asking which Quality Improvement Organization covers your region. You can also search at medicare.gov. Do this now, before you ever need it, and write the number down. Here is your summary of everything we covered today. In 2024, Medicare Advantage plans denied 4.1 million prior authorization requests, and more than 80% of the people who appealed won. The system relies on you not knowing that. Your denial letter starts a 65-day appeal clock from the date printed on it, not the date you opened it. A letter of medical necessity from your doctor is the most powerful tool in a Level 1 appeal. If your health could be harmed by waiting, request an expedited appeal. Your insurer must respond in 72 hours, not 30 days. If your plan denies you twice, Level 2 review is handled by an independent organization outside the insurance company, and you have 60 days to request it. If you are already receiving care and the plan tries to end coverage, call your regional Quality Improvement Organization immediately. Your care continues while they review. 1-800-MEDICARE, 1-800-633-4227 is available 24 hours a day, 7 days a week. Share this with a parent, a sibling, a neighbor, anyone on a Medicare Advantage plan who has ever received a denial letter and just assumed the answer was final. One conversation about what these 5 steps actually are can change what happens to someone when they need care the most. Subscribe, pass this to someone you know who is on Medicare Advantage. I'll see you in the next one.